This is Think Tech Hawaii. Community matters here.
Aloha and mabuhay. My name is Emmy Ortega Anderson, your host for Pinoy Power Hawaii, welcoming you once again for another great episode of Pinoy Power Hawaii here on Think Tech Hawaii. First of all, I'd like to extend my warmest aloha. Thank you very much to the entire staff of Think Tech Hawaii for giving us the privilege and the opportunity to come to your home every Tuesday live. And we discuss topics of empowerment. We aim to enrich, enlighten, educate, and the big picture for us is to empower. Today we're going to do just that with another episode of Amuyukadi, or Did You Know? And with us today is a very well-loved doctor, both in internal medicine, but he is my endocrinologist. I know it's a mouthful. Without further ado, I'd like to introduce and welcome Dr. Russell Yang.
Thank you, Emmy. It's a pleasure to be here.
Doctor, I'm so excited because we've been building up this episode where you're going to come in and empower us with knowledge. And like we always say, knowledge is power, and education is the key. So let's start with how did you get started and your education?
So I like the GI tract. I'm a gastroenterologist, and I like the GI tract because there's 8 organ systems from mouth to rear. And so it's kind of fun to treat all those different processes. And so I got into this because I did 3 years of internal medicine training at Duke, and then I decided I really liked the pancreas gland, and so I started to specialize in the pancreas gland and did research and went to University of Southern California to learn that, and UT Southwestern in Dallas, and so it's been a lot of fun.
Wow, a lot of education. And I stand corrected. I meant gastroenterologist.
Yes,
yeah.
I understood.
They're related, though, right?
They are somewhat
sense?
related. That's
Right.
right. It's related through nutrition and metabolism, which is so important.
All right. So, you know, I know that you cover a big spectrum from the mouth to all the way to the rear, if I may just say it.
That's right.
And a lot of the diseases today can be prevented if we took the proper step.
That is so true. When you look at problems that bother people, 3 or 4 of the major ones are in the GI tract.
Okay,
all
and
the way
those
from
are?
Heartburn to rectal bleeding to colon cancer to hemorrhoids.
Okay. So, dagito excuse me for just a minute. Dagito yung baga ni Dr. Russell yang kakabsat kaya talaga importante launay. Manipod itingiwat tayo, aging gana iti likod wenno kimot tayo. And dagito ket talagang importante for good health, no daytay optimum health iti sapsapulan nyo, no kasapulan nyo iti talagang kangatuang nga sagrado iti salunat. Please seek the advice and also the opinion of Dr. Russell Yang. I'm plugging him in because he is my doctor, and next week I will have the pleasure of going through that famous
Colonoscopy.
Yes, I didn't know how to term it other than telling it like it is. And a lot of people sometimes, Doc, are afraid of the unknown. And I have a saying that what you know may heal you, but what you don't know may kill you. Does that make sense to you?
I love that phrase. And it's so true, especially for Hawaii and the Filipino community, because in the Philippines, you don't really have that much colon cancer screening, for instance. And so it's a newer concept to many people who have immigrated here and who live here. But we try to make these things that are scary to some people easy and accessible so that they'll undergo the screening.
Yes, and you know, your office is just a central information system for good health. In fact, you are under the umbrella of TLC. So
yes, I like practicing there because it's centrally located. There's parking. It's very friendly. We try to create a very friendly atmosphere, and we speak all different kinds of languages there, and so it's kind of fun.
Yeah, and you got Pinoy power, of course. Yeah, and
Yeah.
that's what our listeners are most excited about when they ask me questions. Oh, problema, maawatan nga ta ni doktor daytoy langwahe. Will the doctor be able to understand my language? And I said, oh, don't worry, just make the appointment because there are our kababayans that speak the language, and if you have hard time understanding, they'll be more than happy to step in. So.
How kind of you. You know, what's interesting, in our office, we have state-of-the-art graphics, and we have iPads and wall boards to demonstrate to patients what's going to happen. And we're more than willing to answer different questions because this is an important topic. And we have, I have several assistants who speak Tagalog or Ilocano.
Yeah,
so
they are
nice.
well versed.
Yes.
And they are very accommodating, and you just feel so welcome over there. It's like one big happy family.
Yes, we we emphasize happy, and we want to make the whole process easy and understandable.
A wonderful experience for all,
yes.
yeah. And that's what I get. That's why I keep coming back to
Thank
your
you.
office because the people are so wonderful. And then you as a doctor, you know, sometimes people are reluctant to go in because, oh, the doctor has such poor bedside manners, you know, because they don't know how to put the patient at ease. In your case, you talk story, you lighten it up, and not be so serious and so morose, you know?
I think a lot of the care of a patient has to do with their relationship with the physician. And if I may not even speak their language, I can still understand them and still communicate with them, and that's important to me. And I always say that the better patient is the one who really understands what's going on. Then they have buy-in, and they're more likely to get better because they understand the process instead of just saying yes, yes, yes.
That's true. But it's really, really important, your role, doctor, to make people at ease. And, you know, you exude the aloha spirit.
Oh,
did
thank
they ever
you.
tell you that you look Hawaiian more than...
Yes, until I try to pronounce their names.
Okay, but anyway, you do live the aloha spirit, and that is something that is very obvious in your countenance and your relationship with others, because I've seen you interact.
Oh,
Yeah.
thank you.
So
Thank you.
it's not like the typical doctor to patient relationship, but friend to friend, which
Yeah,
put people at ease.
We try to do this. We try to treat everybody like they're our family, and we understand, for instance, that because of cultural issues, there may be barriers, and we try to overcome them. Especially, you know, the Filipino community is so strong here and so prevalent in Hawaii that it's important to address their concerns directly.
Yeah, that is important because we are the largest minority ethnic group. Next to the Howleys, if I can say that, right?
Yeah.
Yeah. But we are big in numbers, and certainly we seek for the best person in that profession. And this is where you come in.
Thank you. Yeah. I think that's so important, is to understand the background and what the needs are of the patient, especially if you're going to do, not invasive, but if you're going to do tests and procedures on a patient, that you have some sensitivity towards that.
Well, in a sense where it becomes very personal.
Yeah.
Because you're dealing with personal parts of the body.
This is so true.
Yeah.
Yes.
So it's even more important to, you know, handle it with care, right, Doc?
That's it exactly.
Okay. So take us for a moment. When they come in and, you know, they have a diagnosis that is not so pleasant to hear. Do you just come out? I mean, I have a doctor that just say, well, it is what it is. You know, he doesn't even butter it up and issue through the transition of hearing the, quote, negative or bad news.
So I think it's so important that you're straightforward with the patient. So it's not that I won't sugarcoat it, but I'm pretty direct. Right. But I think it's important. What a patient lacks is not the knowledge, but the perspective. And I think that's the role of the physician, is to give them perspective, whether it's diarrhea or constipation or heartburn or colon cancer screening, is that they have the perspective so that they understand what it means, what their symptoms mean in terms of their overall health and their life. And once you do that, patients are very accepting about their diagnosis, and they understand what's going on.
So it is important to put yourself in the patient's seat, right?
I always do. I don't ask a patient to do something that I haven't already experienced or that I have a lot of experience in treating. And we try to do it in a very nice and accommodating way.
Well, that's really, really important. And if I may ask, Doctor, what led you to specialize in the gastroenterologist? Was there something that happened in the family, or?
Well, you know, I have a PhD in biochemistry and nutrition and protein dynamics. And so the GI tract is a natural extension of that research. And so I began to seek out opportunities that would allow me to do science and translate it into treating patients. And so GI was a sort of a natural thing. And plus, I have extra long index finger, and so
that will certainly be an important tool, right?
Yes.
Yes. Yeah. Well, you are funny.
Yeah.
So kakabsat, dati ko na ni Dr. yang itatayin talagang importante dito early detection can kastamot kitay talagang panakaawat, understanding, specializing in that field. You know, Doc, nutrition is a key. Some of us refuses to hear about the phrase, we are what we eat.
Yes, it is so true. I always say what goes through your lips will become you. And nutrition is very important. The rate of obesity in the United States is so high. It's linked to so many different diseases like diabetes, like hypertension. And in fact, at TLC, we are focused, one of our focuses is on weight loss. And I think that's so important. Also, if you form good dietary habits, and I have a good, what I call good bowel hygiene, with lots of fruits and vegetables, lots of fluids, it becomes it's so important and can be life-changing, especially if you have problems like diarrhea or constipation.
Yes.
Very often it might be diet-related.
Well, I really believe, because even my daughter is in nutrition. She majored in nutrition from BYU.
Oh,
so
wow.
I'm getting more educated by the facts that she shares. And she stresses fiber. And you would agree to that.
Oh, yes. I think that fiber plays such an important role. The studies are better in women, actually, than in men. But fiber does all kinds of things. And regular intake of fiber, and the Surgeon General recommends 6 to 8 portions of fiber a day. So it's actually quite a bit. And all fiber is undigested plant parts.
Okay.
And the plant parts hold on to water. And so if you take fiber and you drink water, depending on how much water you drink, if you're constipated, for instance, you'll have better bowel movements. And if you're having diarrhea, you take the fiber with less water, and the fiber will absorb whatever is in your gut lumen, and you'll feel better. Your stools will bulk up. And the fiber has so many good different things. First of all, it's very easy in Hawaii because we have so many good fruits and vegetables. And the fiber can pull out carcinogens, things that cause cancer in your diet, fats, sugars, and it can make you feel better by having good evacuation and elimination every day.
Oh, release me.
It's so true. It's so true.
Dr. Russell Yang is our guest for our segment, and we need to take a quick break. We will continue our conversation about our overall health from our mouth to our rear. That is his specialty. So please stay tuned. We will be right back here on Pinoy Power Hawaii.
Hey, aloha, and welcome to the Think Tech Hawaii studios. I'm Andrew Lang, the host of Security Matters Hawaii. I'm airing here every Tuesday at 10 a.m. Hawaii time, and I'm trying to bring this community information, security information specifically, that will help you live a safer life, help keep our community safer, and help keep our businesses safer. So join me, because security matters. Aloha.
Hello, I'm Yukari Kunisue. I'm your host of new Japanese language show on Think Tech Hawaii called Konnichiwa Hawaii, broadcasting live every other Monday at 2 p.m. Please join us where we discuss important and useful information for the Japanese language community in Hawaii. The show will be all in Japanese. Hope you can join us every other Monday at 2 p.m.
Welcome back to the second portion of Pinoy Power Hawaii. Our guest today is Dr. Russell Yang, and he is my gastroenterologist.
Very good.
Did I say it right, Doc?
You did.
Okay.
Very good.
I will have the procedure next week, Wednesday. Colonoscopy.
Yeah, very good.
Okay.
You're getting better with these
Hey, I'm
terms.
trying to understand, man. This is one Tita you're talking to
Yeah.
who grew up in Lanai.
Did you?
Yeah.
Oh, boy.
So I'm learning, doctor, but
Okay.
you make it such an easy, easy adventure voyage because
Good.
listening to you is just like telling stories.
Oh,
Yeah.
good.
So earlier we were talking about the importance of fiber, and along with that, the importance of drinking the recommended 6, 8, 10 glasses of water.
Yes. The Surgeon General recommends the more fluids, the better. But starting around 6 glasses of fluids a day would be wonderful. And I think even in addition to that, it's important for you just to do that directly with the fiber intake that you do. So if you take a preparation like Metamucil or Citrussil, it's important to take the water directly with it. If you're eating salad and vegetables and fruits, it's important to drink the water directly
Wash
with
it down.
Yeah, and you know, if you do it properly, you might even lose some weight because you'll feel so full and satiated that you won't want to eat much more. So a lot of my female patients like to change the habit, and they actually lose a few pounds, so it's kind of nice.
I've learned that from TLC, from the
Yes.
weight loss, and you know, the Dr. Lisa and Dr. Yo,
Yes.
Dr. Kai,
Yes.
make it an overall pleasant experience to.
It's nice to work in an environment where we're all united towards
Yes.
helping patients and improving their lives. Yes.
And the word TLC, we provided with, I interpret it as tender, loving care from
yeah.
wonderful doctors that really care about your health.
Thank you.
Yeah.
Thank you.
So let's go back to our main focus, which is our intestinal tract, the health. Take us on a journey, doctor.
So most of us are focused in preventative health, and one of the most common cancers out there is colon cancer. Colon is, of course, your large intestine, and it's the third most common cancer. It leads to a large number of cancer deaths. So we're all focused on trying to get even normal, healthy patients screened for colon cancer. Usually we start at the age of 50. But we're realizing now that colon cancer starts even earlier.
Yes.
And so the new national guidelines in a few years will be even start earlier at age 45. If you're African American, you might even start earlier.
It's even higher.
So that's important.
Yeah. So, doctor, the rate is alarming. What is the ratio? Because my mother has had parts of her colon taken out. She's lucky that they were able to sew it back
Sure.
together.
Yes.
My husband, who is 90 years young,
Wow.
was lucky to be able to connect the healthy intestines back together, so where he doesn't have to wear a bag.
Yes.
But for 90 years of his life, his intestines has been working right there for him.
Yes. You know, you bring up a good point. That is that you can live a long time if you take the right steps and prevent this kind of cancer. In addition, the cancer, colon cancer, is a little unusual in the sense we can find the precursor lesion, the lesion that starts the cancer, early,
Early.
remove that lesion, and thereby prevent cancer. And that's the name of the game in my
That's
mind.
the key, yeah?
Yes, yes. That's why I think everybody over the age of 50 should go get tested for colon cancer.
Okay, kunat ni Dr. Yang kakabsat nga importante launay nga no 50 iti taon tayon, 50 years old, some nasapsapa pa lalo dagitay Black Americans ket nasapsapa pa dito pinaka-check up dito nga bagbagis tayo. But you would say how many out of 10 would end up having problems or challenges with the intestines, Doc?
So, well, intestinal symptoms very often predict whether you have colon cancer or not. So if you have blood in your stool,
Okay, so that's
or
one.
if you lose, or you're losing blood, so you have an anemia,
Oh,
or you're
okay.
losing weight and don't understand why you're losing weight, or if you have thin, I always say doo-doo, but if you have thin doo-doo or flat doo-doo, in other words, a change in the shape of your bowel movement, then those are important indicators that something has changed.
Yeah. So a normal one would be the big normal round like sausage.
So I always say,
Yeah,
yes.
I'm sorry.
Yes, basically it's like
Yeah.
bananas.
Bananas.
If you wish.
Oh, boy.
If you wish.
Yeah, King Kong
I don't want to
size.
ruin that for the but
Okay.
but I think it's important. It's whatever your natural habits are.
Okay.
So, you know, some people go a couple times a day. Some people go once every 2 days.
Yes.
And so the pattern of normal varies.
But that's
So-
not normal. If you go once every 2 days, that's
well, if it's not normal if you're suffering from gas and bloating and you feel uncomfortable,
Right.
then that's not normal. But some people do. And so I think it's just important to understand that if there's a change in your bowel habits, so let's say you go to the bathroom once a day,
Right.
every day for years,
normal for
and
you.
then all of a sudden you stop going
It
and you
changes.
only go every 3 days, that's a pretty dramatic change.
Yes.
Alternatively, if you go 3 times a day, then that is also a big change. And so you have to just sort of pay attention to that, that something's changing. And especially if you're in the 50 range and something changes like that, then you want to seek medical care to get checked out.
So in other words, be aware and be constantly checking
Right.
of the changes and
Right.
what's going on.
And then you have to just sort of decide because you can have a cancer, colon cancer, and never have any symptoms. And so I think it's important just to decide at age 50, I'm going to have a colonoscopy.
Okay,
And
so
if
how
you-
often should that occur? The
So
colonoscopy?
you have a colonoscopy, and if I look inside and you don't have anything, then I say 10 years.
Really?
Okay, yeah. Oh, yes. If you
But a
have
lot of
polyps,
things can develop within
that's right.
that
So if
period.
you pay attention to symptoms, or if you have polyps, then we do it sooner, as often as a year, or maybe 3 years or 5 years. We'll repeat it sooner. Remember that because we can find the change before it turns into cancer, we can look and prevent cancer, and so we know it can be a slow process, and so that's why we decide what interval it will be.
That-
But we'll make that judgment once we do a colonoscopy. The most important is to look and to know.
Go
so you
inside
can,
and-
so then you can make a decision.
Right.
Yes.
Wow, I'm glad I took the step
Yes.
to make that appointment, because for a while, I said, as long as I'm eating right, I'm making the right choices, I'm eating lots of fruits and vegetables,
Yes.
I think I'm going to be okay. But it's really, really important to go in and for the screening.
just get checked out. It's we have tried to design a easy system, if you will, and a pleasant system and a nice system to have the test done. The only uncomfortable situation is you have to drink a preparation that gets you really pretty flushed out.
Yeah, people are
so-
afraid of that too. So
Yeah.
let's explain the process real quickly.
So basically what you do before a colonoscopy is that you'll drink a solution. The day before, you'll drink nothing but liquids.
It's 100% covered, by the way. I went to pick up my kid yesterday.
Yes, that's how important it is.
Yes.
Even in the era of Obamacare, colonoscopies covered. So that's
Okay.
how universally everyone recognizes.
So it doesn't
this
cost
is
them
important.
anything
It should
to
not. It
have
should
that
not.
screening.
And I try to change the prescription so whatever the medicine is that they use for the preparation is covered under their insurance.
Yes, I was surprised because
Yes.
normally I'm used to paying some kind of a copay, and they said,
Right.
"Oh, you don't owe anything." I said,
That-
"Wow."
That's right. So it's covered. So the patient, if it's covered, the patient only has to decide to have it done. And that's what's important to me, is to make sure the patient understands what they need and to go through it.
Right,
And then
right.
once you go through it and you have polyps, or we have a finding, or nothing, then your mind is at ease.
Right.
Then you can say, okay, 10 years, 5 years, 3
Right.
years, 1 year. So then and also you fall into the care, and very often patients have gas and bloating, or they feel uncomfortable, or they have a little nausea, and so they sort of figure out what goes on. Because besides changes in bowel habits like diarrhea or constipation, heartburn is also very common, and so you get in under the care of a gastroenterologist, and you can do pretty well that way. You can get these common symptoms taken care of.
Yeah. I know that we have a picture of the colon. If oh, no images. Okay. Anyway,
Okay.
but describe to us, Doc, how long is the average?
So your colon is 6 to 8 feet long, and it's your large intestine.
Okay.
And so it's the final stop before you process whatever you ingest comes out. And so that's why you ask questions about the change in shape or the change in color or how you feel, because that's the final stop. And the colon or large intestine, the cancer affects both men and women equally, and so that's why there's no
discrimination.
There's no discrimination.
Okay.
And it is age-related, so the longer you go, like your husband, you tend to collect cancers as you get older, and colon is one of them.
Okay. I was told, Doc, that we all have cancers in our system, right? It's just a matter of when that is awakened or when it flares up. Explain that thinking.
So that's very interesting. It's so true. You know, your cells and your metabolism change over all the time. And if you as you go along and you're exposed to a chemical or have some habit of eating a certain kind of food that may not be good for you, or too much fat, for instance, then you begin to change your genetics of those cells. And cancer is nothing more than cells that grow awry. So they're normal cells, but they grow without control. And then they grow into a mass or
something triggers it.
Right, and then they spread, and that's when you get into trouble.
Okay. With the little time that we have remaining, Doctor, how could they contact you, or how could they make an appointment?
So we are at 1650 Laliha, centrally located. We have a nice parking lot in front of our building, and the phone number is 376-2100, and I have a Filipino operator who will take your information, and she's very nice, and she'll explain things, and you'll get a flavor for our practice. And we also have nurses there, and we're more than willing to just answer questions. If you have questions, you just leave a message.
Okay. Mga kaibigan, you heard the contact number 376-2100, parte iti TLC Medical Center ni Dr. Russell Yang, and again, his specialty is gastroenterologist. And he is my doctor. Happy to say that I am very pleased with the services that he provides, as well as the many other doctors that make up TLC Medical Center. Thank you again for giving us the opportunity to come into your home Tuesdays live, 12 noon, here on Think Tech Hawaii. And I'm going to close by saying, mabuhay, maraming salamat po from Pinoy Power Hawaii.